It's been 12 months since the Upper West Regional Hospital started operations. Correspondent Rafiq Salam in this report reviews the operations of a hospital that has attended to over 18,000 outpatients and performed more than 5,000 surgeries. Here's his report.
Akufo-Addo commissioned the Upper West Regional Hospital on 18th August 2019, but it started opening its doors to patients on January 9, 2020. The construction of the over $51 million magnificent state-of-the-art turnkey project was expected to be completed in 2014. It, however, delayed owing to some constructional and administrative challenges. 5 months after the pomp and pageantry that characterized its commissioning, Director General of the Ghana Health Service, Dr. Patrick Kumar Boaji, led members of the Ghana Health Services Council to open the hospital after a brief ceremony at the forecourt of the facility. The mantle of leadership of the hospital was handed over to renowned orthopedic surgeon Dr. Robert Amesia. The operation of the hospital over the one-year period had not been smooth sailing, as recounted by the hospital's head of administration, Francis Lugunia. The hospital started operation without seed fund from the government and has to depend on the benevolence of its cadre staff.
Within the first few days, staff had to even contribute money from their own pockets to buy some few consumables, to get the hospital started.
The hospital has one vehicle to take care of its transportation needs. Head of finance at the hospital, John Sakat Larry, spoke of the frustration they go through with the usage of the vehicle.
You have to run up and down a big hospital like this without transport. And even in our banking activity, we are not supposed to go to bank with any private means. So you can imagine we are all scrambling for this one vehicle. If you are ready to go to bank, you have to wait for somebody, if he's somewhere with their car, to come before you are able to go. So we need a whole lot of resources.
Another area of concern was the recruitment of staff for the hospital. Deputy Director of Nursing Services, Lindana Okalimetal, opined the number of nurses and midwives required for the hospital to function effectively and efficiently should not be less than 350. Yet, they started with a paltry 147.
The number required to start this hospital, looking at the number of units within the hospital, the various departments and the units, and then the number of beds that are available in each unit. For each unit, we have a 40-bed capacity for the medical, surgical, the kids ward is 48. And each ward is supposed to have at least the minimum 25 staff to run the 3 shifts. And I have almost about 17 units. So if I'm multiplying 25 by that, means I have to be getting almost more than 300 staffs. But I started with 147.
Though the number of medical doctors at the start has increased over the one-year period, emergency physician and clinical care coordinator, Dr. Emmanuel Steve Blankson, is of the opinion that there's still room for improvement.
From the number 4 up to 16 and counting. Initially, we were just having myself, the medical director, who is the orthopedic surgeon, and then an ONG specialist and a medical officer. Now we have another general surgeon who has returned from school, as well as another physician specialist, and we've had more than about 10 medical officers that we started. So this has helped us a lot as our patient load has now increased. Now with our visibility, a lot more referrals are coming, and we have been able to do it. But as a regional hospital, this is woefully inadequate.
Medical superintendent of the hospital, Dr. Robert Amesia, ran me through the number of medical and surgical cases that the hospital has attended to in this year's operation.
The interesting thing about our hospital is that all the specialists, even though we are few in the region, are concentrated in this hospital. So it's like a referral hospital for the region. So For the 1 year, the over 18,000 people that we have seen, I'm sure if we were not here, they would have had to find their way to other regions for services. So that is not a mean achievement. When it comes to the people that we admitted to the various wards, we talk of almost over 5,000 admissions. Majority of these admissions are surgeries that are done. We have an obstetrician gynecologist, so we have people who come with gynecological emergencies and also elective gynecological problems like fibroid necrosis, tumors, etc. So if you go to the ONG unit, they have conducted over 500 surgeries. And then when you come to the unit of which I'm part, we have conducted over 1,000 surgeries. When you put all that together, that is over 1,500 surgeries.
At the surgical ward of the hospital, there are dozens of patients who hail from other regions in the country, apart from the Upper West region. Alima Ibrahim hails from Obuasi in the Asante region. She has a condition that requires the attention of an orthopedic surgeon. Another is a civil engineer, Yakubu Ali, who works in Ketekrachi in the Oti region and had an accident on his way to the region.
They have attended to me. I think Dr. Robert himself did the operation to get the pelvic fracture fixed, and I have been put on traction for the past 3 weeks, and it's getting better. Yes, it would have been very, very difficult. Probably I would have been taken outside the region for treatment because I went to the one municipal hospital first, and from there they referred me here. So probably if this facility was not here, I would have been thinking about going outside the region for treatment.
So in terms of costing...